So what is the definition of antagonist? Antagonist basically means it counteracts the action of something. So, if we hear opioid antagonist, it means that it counteracts the action of the opioid. So it stops it. It doesn't let the opioid go through. A substance that counteracts the action of something else is an antagonist. Nice. We have two very common opioid antagonists. They are generically known as, is it
Exoe.
O-N-E.
Like that?
Yeah. No,
Okay.
no.
Nalo.
I think it's the O.
O-X.
Yeah.
Like that? Okay.
O-N. O-X-O-N.
N-A-L-O-X-O-N-E.
Okay, so there's an O right there. Naloxone and ha!
So there.
Yes, I did.
That's
Now Menfin. Okay? Naloxone is Narcan. And I forgot what the trade name of Nalsamin was. But these are the two most common opioid antagonists we use today. There is another one that we use for alcohol dependency. And that's our friend Revex. We have to use Revex when they're alcoholics because alcoholics go through withdrawal just like druggies. They could have seizures, they could pass out, they could lose consciousness just because of their bodies withdrawing from the alcohol. So that's what Revex is for, okay? Naloxone, being Narcan, is the most potent antagonist we have. Naloxone will restore the respiratory in 1 to 2 minutes. Meaning if my respiratory rate goes to 6 and immediately they give me Narcan, in 1 to 2 minutes my respiratory rate will be back to 12 or 14 immediately. When it comes to an opioid antagonistic, it only works for a patient who is taking an opioid. So if they don't take an opioid and we try to use an antagonistic for opioids, it will have no effect on them, okay? An opioid antagonist will have no effect if the individual has not taken the opioid. True or false?
True.
True.
What is it again? Will have no effect.
Will have no effect if the individual has not taken an opioid. When it comes to opioid antagonists, they're used for a couple different things. So I'm going to call Mr. C tomorrow too, and I'm going to tell him that I want a tutor for your pharmacology final and see if he has it ready.
Yeah.
Okay?
And when would that be, Tiffany?
Tomorrow evening, 5:30 to 7:30. So I'm letting Matthew tape me for the whole final review. Okay, that's what I am gonna do, because a lot of people have asked because they can't
Yeah.
be here tomorrow. Okay? All right, so. Okay. I'm giving you 3 things. This is a select all that apply question. There are some adverse reactions when it comes to opioid antagonists. AR, adverse reaction. They are hypertension, tachycardia, and nausea and vomiting. This being usually the first one that they feel, the nausea and vomiting feeling. Another select all that applies. Okay. You may have to use more than 1 dose of an opioid antagonistic. And the reason that you may have to use more than 1 dose is because the effects of opioids may outlast the effects of the Narcan or the antagonistic. So it's okay to keep using it, because we want to keep them out of respiratory distress. The repeat dose of Narcan may be needed because the effects of opioids may outlast the effects of Narcan. So the question being, a repeat dose of Narcan may be needed because. So why may they be needed?
That's longer than ever.
Because the opioids may have a longer effect than the Narcan. Get it? Want me to write it? RPT means repeat. Oh my gosh. Is it okay if I get the top?
Yes.
Hi.
How many questions are there?
Just 20. It's a really simple, easy question or test. When it comes to Narcan and naloxone, opioid antagonists, a very big drawback for using them is the moment you put it in them, it cuts off all receptors in the brain, meaning an opioid is a CNS depressant, so it makes you not feel pain. The moment we use the antagonistic, it counters that effect. So the patient is going to be in severe pain immediately, okay? The patient may experience severe pain again after administering a narcotic antagonist. True or false?
True.
True.
True. When we will frequently use Narcan for patients in the post-anesthesia care unit, PACU.
Do we need to know what that means?
It actually is not going to put it like this, but I put it like this because it's too long for me to write. So, frequently, the use of naloxone, Narcan, for post-operative patients is in the intensive care unit, medical floor, post-anesthesia care unit, operating room. Post-anesthesia care unit, okay? So frequently the use of Narcan is in the post-anesthesia, because anesthesia is the use of an opioid, okay?